A Peruvian mummy buried around 1000 CE still carries the eggs of 3 separate intestinal parasites in the dried tissue of its gut. 3 species, 1 body, and every single one of them entered through the mouth. That is where this starts. Not with plague, not with battlefield wounds, but with the ordinary moment your ancient ancestors swallowed something the world had quietly loaded against them. And what happened next inside that body is stranger and worse than anything you have been told to picture. Before you understood what infection was, you still felt exactly what it did. Picture it in your own hand. A thorn, a shallow cut from a flint edge, nothing worth stopping for. By the next morning, the skin around it is hot to the touch, swollen into a tight ridge, the color of a bruise but angrier. A day after that, pus, yellow-white, thick, collecting under the surface with a pressure that pulses with your heartbeat. You did not need to know what bacteria was to know something had gotten in. Your body knew. The redness, the heat, the swelling, the pain. These 4 signs were already old when the Roman physician Celsus wrote them down in the 1st century CE, rubor, calor, tumor, dolor. He had a name for the pattern 1,000 years before anyone explained it. He just could not tell you what was driving it. The bones remember what the flesh forgets. Skeletal remains from Neolithic sites across Europe and the Levant show lesions on the vertebrae consistent with spinal tuberculosis, the kind of destruction that takes years, hollowing the bone from inside until the spine collapses forward. Some of these individuals survived long enough for the bone to begin remodeling around the damage, which means they lived with it, carried it, kept moving in a world that had no name for what was eating them. A skeleton excavated at the site of Atlat Yam off the coast of Israel, dated to around 9000 BCE, shows the earliest confirmed skeletal evidence of TB in both an adult and a child buried nearby. 9,000 years ago. The disease that would define centuries of European mortality was already in the room, and it was not only the lungs and spine. Dental abscesses show up in skulls from nearly every ancient population ever studied. The tooth decays from the inside out, the pulp chamber fills with bacteria, and the infection has nowhere to go but down through the root, into the jaw, building pressure in a sealed cavity of bone. If it stays there, the pain alone is enough to stop a person from eating. If it breaks through, the bacteria enter the bloodstream. And here is where the cut on your hand and the rotting molar and the infected birth canal all arrive at the same destination. The fever starts. Your body temperature climbs a degree, then 2. The ache behind your eyes is not a headache. It is your immune system burning fuel at a rate your muscles can feel. You stop wanting to eat. Your joints hurt. You sleep, but the sleep is wrong. Too hot, too close to waking. This is the body doing exactly what it was built to do, raising the temperature to slow bacterial reproduction, pulling iron from the blood to starve the invaders, flooding the tissue with white cells. It works, most of the time, but most of the time is not always. And for your ancestor, with no way to close the gap between local inflammation and systemic collapse, the line between the two was invisible until it was crossed. The Edwin Smith Papyrus, an Egyptian medical text copied around 1600 BCE, but drawing on sources older still, describes what the scribes called a smiting of something entering from outside. Infected wounds, suppurating tissue, spreading redness, moving up a limb. The writers noticed the direction. They noticed the smell. They noticed that a wound on the hand could reach the armpit, and that when it did, the outcome changed. They were watching sepsis without the word for it, tracking the red line crawling toward the torso and understanding on some level that its arrival elsewhere in the body was not a good sign. They just had no mechanism, no picture of what was traveling or why. So consider what ordinary life loaded against the body. A woman in ancient Rome giving birth carried a 1 in 10 chance of dying from puerperal fever within days of delivery. The uterus an open wound in a world of unwashed hands. A soldier in any army before the 19th century was more likely to die of the wound going bad than of the wound itself. A farmer bitten by a dog in 1st century Alexandria faced not only the wound, but whatever the dog had been drinking from, whatever it had been eating, whatever lived in the soil the bite pushed the skin into. But here is where it turns. A skeleton from a Bronze Age site in Denmark, dating to around 1400 BCE, shows a healed leg fracture, a healed skull fracture, and evidence of a serious infection in the femur, a cavity in the bone called an involucrum, where the body walled off the bacteria in a shell of new bone rather than clearing it. The person survived, the infection was still there, sealed inside the leg for the rest of that life, not beaten, contained, the body negotiating a ceasefire with something it could not expel, building a wall around the enemy and learning to live with the terms. The ancient body under infection was not simply losing. It was doing everything it had been built across millions of years to do. Sometimes that was enough. Sometimes the fever climbed past the point the brain could survive. And sometimes a healer stepped in. What they reached for next is where it gets difficult to explain without sounding like something has gone wrong. What they reached for was not random. That is the thing that gets lost when you look at it from the outside. Picture the healer standing over a wound gone wrong, the skin around it hot, the edges pulling apart instead of closing, a smell that everyone in the room already recognizes. They do not know about bacteria, they do not know about white cells or cytokines or the cascade your previous section just walked through. What they have is pattern. They have watched this happen before. They watched what came next when nothing was done, and they have watched, sometimes, what happened when something was. So they reach for what the pattern told them to reach for. The Edwin Smith papyrus, which you already met watching sepsis without a name for it, also records treatments. Wounds packed with honey, moldy bread pressed into infected tissue, wine used to wash a wound before closing it. These read like superstition until you look at the mechanism. Honey is hygroscopic, meaning it pulls water out of bacterial cells through osmotic pressure, and its low pH creates an environment where most common pathogens simply cannot reproduce. Raw honey also produces small amounts of hydrogen peroxide as it reacts with tissue fluid. The Egyptians did not know any of this. They knew that wounds packed with honey sometimes did not go bad the way unwashed wounds did. The result preceded the explanation by 3,000 years. The mold on bread is harder to defend universally, and many historians are careful here, but the presence of Penicillium species in stored grain was not rare. And while the application was not controlled or reliable, the observation that something in the raw sometimes helped a wound is not as absurd as it first sounds. The mechanism existed. Whether any given application delivered it is a different question, and an honest one. Hippocrates, writing in the 5th century BCE, recommended wine for wound irrigation. Celsus repeated it in the 1st century CE. Galen carried the practice into the 2nd. Wine is acidic and contains compounds hostile to bacterial growth. It is not sterile. It is not consistent. But against an open wound in a world where the water alternative might be drawn from a river shared with livestock, it was not nothing. Willow bark, used across Greek, Egyptian, and later European traditions for fever and pain, contains salicin, which the body metabolizes into salicylic acid, the active compound in aspirin. The relief was real. The people using it had no idea why. And then there were maggots. Battlefield accounts from the 16th and 17th centuries, including observations attributed to the French surgeon Ambroise Paré, note that wounds colonized by fly larvae in some cases showed less spread of rot than wounds that had not been. The maggots were eating necrotic tissue, only the dead material. They were debriding the wound the way a surgeon would centuries later with a scalpel, leaving the living tissue intact. Paré was troubled by what he saw. The implication was uncomfortable. The filth was helping, but not everything worked. And the honest account requires that too. Bloodletting persisted across Greek, Roman, Islamic, and European medicine for nearly 2,000 years. Galen systematized it. The logic was internally coherent. The body contained humors. Fever was excess heat required reduction, and blood was the obvious vehicle. The logic was wrong at the mechanism, but not invented from nothing. It was built from observation, from pattern, from a framework that had enough explanatory power to survive scrutiny for 20 centuries. The problem was that it killed people. A body already spending enormous resources fighting infection does not benefit from losing a significant fraction of its circulating blood volume. The evidence that it failed was always there. The framework made it hard to see. Cauterization tells a similar story. Burning a wound closed with a heated iron or with boiling oil, a practice Paré himself eventually argued against after watching it on battlefield after battlefield in the 1530s, did in some cases prevent the spread of surface infection by destroying tissue bacteria could colonize. It also destroyed the tissue itself, caused thermal injury on top of the original wound, and in a patient already septic, it was meaningless. The ones it helped were probably going to survive anyway. The ones it harmed were often the ones who could least afford the damage. Here is the concrete case. A soldier at any major engagement before the 19th century takes a wound to the lower leg, not a killing blow, something a modern emergency room clears in an hour. By the 3rd day, the wound is suppurating. By the 5th, the red line is moving up the shin. The surgeon, trained in the tradition of Celsus and Galen, packs the wound, bleeds the patient, applies a poultice, possibly cauterizes the edges. The red line keeps moving. By the 7th day, it reaches the groin. The decision to amputate, if it comes at all, comes late, because the framework did not tell him to cut until the limb was already lost in everything but name. The surgery itself performed without anesthesia, without antisepsis, with instruments cleaned only between uses, if at all, introduced new vectors into a body already collapsing. Most did not survive it, not because the surgeon was careless, because the surgeon was working at the edge of what his tradition knew, and that edge was not far enough. And yet here is where the obvious reading fails. These people were not stupid. Hippocrates wrote that the physician should first do no harm, which implies he had already watched harm being done and had started to think about the distance between intention and outcome. Perry stopped using boiling oil because he ran out of it one night, used a milder dressing from necessity, and in the morning found those patients sleeping more comfortably than the ones who had received the standard treatment. He wrote it down. He changed. The evidence reached him and he followed it. That is the shape of every slow correction in the history of medicine. Not revelation, not a single genius overturning the old world. A practitioner running out of oil, looking at two groups of patients and noticing that the numbers did not match what they were supposed to say. Your immune system carries the history of every one of those corrections in its own architecture. The inflammation response that makes your finger hot around a splinter is older than any of these names. The fever that keeps you in bed for 3 days is the same fever that rolled through a soldier in Roman Gaul and a farmer in Bronze Age Anatolia. The scar tissue that forms over a healing wound is your body doing exactly what the Bronze Age skeleton from Denmark was doing, building a wall, sealing the problem, negotiating terms with something it cannot fully expel. You inherited the machinery. You also inherited the vulnerabilities. The sepsis that killed people in the ancient world kills people now. The biology did not change. Only the tools around it changed slowly through people who watched patterns and followed the evidence wherever it was willing to go. Picture your ancestor again. Not the hunter on the savannah, not the body under fever, but the healer crouching over both of them, holding honey, holding willow bark, holding something that works for reasons they cannot name. They did not know the mechanism, they knew the result. And across 10,000 years of watching what happened when you did something and what happened when you did nothing, they built a tradition that was wrong in its explanations and sometimes right in its outcomes, which is exactly how knowledge looks before it becomes knowledge. The ancient infected body was not simply losing. And the people tending it were not simply guessing. They were doing what every mind in this story has done, reading the pattern in the dirt, following something they could not fully see, and adjusting when the ground told them they were wrong. If that sounds familiar, it should. The body you are sitting in right now is the outcome of every one of those adjustments. Every healer who noticed something. Every patient whose immune system held the line long enough for the observation to be recorded. You are the version that made it. And if you want to understand how close that margin was and how strange the machinery underneath it really is, the previous video on what your immune system actually costs your body is a place to start.